Hello everyone, I am Thormod from Nisonic, and in this presentation I will talk about the basics of the Nisonic methods for detecting increased intracranial pressure, also referred to as raised ICP or elevated ICP. How is it possible to estimate ICP by using ultrasound images of the eye and optic nerve? As you will see, although the processing of the ultrasound images is very advanced, the principles behind the methods are actually quite simple. When discussing intracranial pressure, we should keep in mind that the brain is suspended in cerebrospinal fluid within the meninges covering the brain and spine. The ICP is the pressure of the fluid inside the skull that is acting on the brain tissue. Elevated intracranial pressure is a medical emergency that can lead to tissue damage, and it is potentially life-threatening. Early detection and treatment of raised intracranial pressure is important to obtain a good clinical outcome. Elevated intracranial pressure can be caused by swelling of the brain or growing processes as tumors inside the cranium. As the intact cranium represents a rigid frame for the brain, an increase in the volume will lead to an increase in the ICP. There are a wide range of clinical causes for raised intracranial pressure, including traumatic brain injuries, intracranial bleedings, hydrocephalus, and brain tumors. Thereby, it is a large number of patients that might have a condition of increased intracranial pressure. There are several techniques for measuring ICP, but all the conventional methods today are requiring brain surgery. The measurements can be performed by inserting a catheter into the ventricle centrally in the brain, or by placing a pressure sensor in the brain tissue. ICP is usually measured in millimeter mercury, and ICP above 20 millimeter mercury is considered as elevated ICP needing treatment. The conventional methods today have several drawbacks. They are expensive, there is a risk of complications, and the surgery requires highly specialized personnel. There is a clinical need for a simpler way of detecting elevated ICP. To understand the physiology that provides the basis for Nisonic methods for detection of elevated intracranial pressure, we need to look at the anatomy of the central nervous system. The eyes are directly connected to the brain by the optic nerves, and in fact the nerves are covered by CSF and layers of meninges as the brain. The meninges of the optic nerve are commonly referred to as the optic nerve sheath. The brain is covered by CSF and the meninges, and the CSF is also present in the layer between the optic nerve and the optic nerve sheath. If the patient has a clinical condition where the brain is swelling, the increase in volume in the intracranial space will cause the ICP to increase. As the optic nerve is connected to the intracranial space, the CSF pressure along the optic nerve will also increase, causing the optic nerve sheath to dilate and to become stiffer. The changes to the optic nerve sheath can be imaged and measured by using ultrasound imaging, placing the transducer on top of the patient's eyelid. The optic nerve sheath diameter has in recent years gained use as an indicator for intracranial pressure, where the higher ICP will result in a larger diameter. By using an ultrasound machine and a suitable transducer, the measurement of ONSD can be done as a bedside examination. It is published over 560 papers about ONSD and its use for detecting elevated ICP. However, the studies has also shown that there are larger inter-observer variations, and thereby it is difficult to compare diameter measurements between users and between hospitals. This variation on ONSD measurements may be due to individual preferences on how to perform the diameter measurements. It can be caused by different transducer and machines giving varying image quality, and there might be anatomical variations. Still, the clinical value of ONSD is that it can be used as a non-invasive marker for separating between normal ICP and raised ICP patients, and furthermore to see how the ICP is changing over time for a given patient. The Nisonic P100 ultrasound machine has a transducer designed specifically for ultrasound imaging of the optic nerve sheath and is using machine learning-based image processing to ensure repeatable and user-independent measurements of the ONSD. If the ICP is increasing, the optic nerve sheath will become stiffer and thereby less deformable. A unique and patented method by Nisonic is estimating the displacements at specific regions on both sides of the optic nerve sheath in order to calculate a parameter of deformability, the deformability index. The method was developed by neurosurgeons at University of Cape Town in South Africa and scientists at SINTEF in Trondheim, Norway. It was hypothesized that elevated ICP would cause the stiffness of the optic nerve sheath to increase, and thereby the deformability index should be lower. The results in 2 studies performed on pediatric patients demonstrated indeed that the deformability index was able to separate between normal and increased ICP, both as a parameter alone and when combined with the optic nerve sheath diameter. Clinical studies regarding the use of the deformability index for detection of elevated ICP has been published in neurosurgery and other neurosurgical journals. Nisonic aims to simplify detection of elevated ICP using transorbital ultrasound imaging and machine learning, as illustrated by the high ICP and the normal ICP case shown here. The Nisonic P100 scanner provides state-of-the-art ultrasound images of the optic nerve sheath and has several novel and unique features implemented. It provides graphical guidance on how to obtain the best ultrasound images of the optic nerve sheath. It provides automated and real-time measurements of the optic nerve sheath diameter. It provides automated measurements of the optic nerve sheath deformability by calculating the deformability index. The Nisonic P100 thereby offers automated measurements of 2 independent parameters that are correlated with ICP. This provides the basis for more accurate detection of elevated intracranial pressure compared to any other non-invasive methods. The Nisonic processing results also provides the basis for calculating numerical values for intracranial pressure. Nisonic is currently collecting ultrasound images and clinical data from partner hospitals in Africa and Europe. The technology is being further developed and verified, bringing hope for faster and better measurements of elevated ICP. So to summarize, the ICP is the fluid pressure inside the skull that is acting on the brain tissue. The optic nerve is connected to the intracranial space. The pressure of the cerebrospinal fluid between the optic nerve and the optic nerve sheath is correlated with the intracranial pressure. Raised ICP will cause the optic nerve sheath to expand, and thereby the diameter will increase, and it will also become stiffer and thereby less deformable, so the deformability index will be lower. The diameter and dynamics of the optic nerve sheath can be imaged and measured using ultrasound imaging. And Nisonic is providing a CE-marked ultrasound scanner with automated measurements of ONSD and deformability index, parameters that has been shown in clinical studies to be correlated with ICP. Thank you for watching this presentation. If you have any questions or would like to have more information, please do not hesitate to send me an email on the address below.